Hello, everyone. Thank you for joining us this evening to talk about the multi-site health study. Before we get started, I do want to note that this information session is being recorded. I also am going to ask everyone to remain on mute with your microphones and videos off during the presentation. There will be time to ask questions at the end, where you can ask our research team any of your questions about the study. You can type those questions into the chat at any point during the presentation, and we can read those at the end. You can also wait and ask your question verbally at the end of the presentation. I just want to really welcome you all and tell you I really appreciate that you're taking the time out of your evening to listen to us talk about the multi-site health study, this very important PFAS research project. My name is Ellery Johnson, and I am from the Michigan Department of Health and Human Services from the state of Michigan. I am the Community Engagement Coordinator on this PFAS project. I work with many other staff and researchers at MDHHS, and I would like to introduce you to some of those researchers today who will also be here to talk about the study and then to answer any of your questions. I would now like to ask my colleagues to turn their cameras on, and we can go through and introduce ourselves, starting with our toxicologist, Jordan.
Hi, yes, I'm Jordan Bailey. I'm a toxicologist on the program. I work here in the Division of Environmental Health with the rest of my colleagues here today.
Hello, my name is Joost Venturf. I'm also a toxicologist working on the multi-site study.
Hi, everyone. My name is Taylor Sullivan. I'm an environmental epidemiologist, also working on the study.
I'm Laura Abington, also an epidemiologist on the study.
Perfect, thank you. You'll be hearing from each of these researchers today during the presentation. As a reminder, if you have any questions at any time, you can always type them into the questions or the chat box on your screen. We will be monitoring the chat and we will read out the questions at the end. If you have questions and are calling into the presentation, you can also send us any of your questions. We do want to hear them. If you need to email us any questions, we do have a project email inbox, and that email address I can type into the chat. Verbally, it is mdhhs-pfashealthstudy@michigan.gov. You can email us and we'll get back to you. Now, without any further ado, I would like to talk a little bit about the multi-site health study, MSS, which is a really exciting research project that's happening right now in the Belmont Rockford area, the City of Parchment, and Cooper Township, as well as a few other places in the United States, as we'll go over later. The Michigan Department of Health and Human Services has partnered with the CDC's Agency for Toxic Substances and Disease Registry, or ATSDR, for this study. The multi-site health study is a new nationwide PFAS health study that is taking place across 7 states, including in Michigan. In Michigan, as I mentioned, the study areas are the City of Parchment, Cooper Township, and the Belmont Rockford area. The City of Parchment and Cooper Township and the Belmont Rockford area were selected specifically because the PFAS contamination of the drinking water is thought to have affected a relatively large population, a population that's large enough to warrant a study. As I said, this is a nationwide study that's taking place in Michigan, as well as in Colorado, Pennsylvania, New Jersey, Massachusetts, New York, and California. All of these states are working cooperatively and collaboratively together to launch and implement this study. The study is currently open for enrollment in Michigan, and it has been since the beginning of September. We plan to keep the study office open for about 6 months of data collection.
So the goal of the multi-site health study is to really understand the relationship between PFAS exposure and health outcomes in different populations. And different populations are reflected here in the various states and communities that were selected for this research project. MSS has a large nationwide population from coast to coast, where younger kids and adults can provide information on additional measures outside of what we collect from our statewide study, MIPES, on things like neurobehavioral testing and school records abstraction. Next slide. Thanks. So during the study, all participants are going to be asked to complete a health survey, provide a blood sample, and body measurements. That's very similar to the MIPES study that we're doing right now. But then in addition, MSS participants will be asked to provide a urine sample as well and allow access to medical records. The study is also going to be looking at children's behavioral and cognitive development. And it's also important to note that all states in MSS are using the exact same protocol, the same method. So it's going to be very uniform throughout the 7 sites.
So as Laura said, so every site that we're trying to keep them as similar as possible. So at the end of everything, we can combine the data together. So that includes who is eligible for the study. So for our state, for Michigan, we have the 2 communities, so the Parchment and Cooper Township, and then the Belmont Rockford area. We're looking to enroll adults 18 and older, and then especially children 4 to 17, which makes it very distinct from other studies that are maybe enrolling in the past. You can see the 2 maps here on the slide ahead of you. So that's sort of our geographic study boundaries. So if you're within that area and live within the Parchment and Cooper Township and live there, you are eligible to participate in MIPES, having had your drinking water there between 2006 and 2018. The Belmont Rockford area is a tiny bit more complicated. Again, there we have the same sort of geographical boundaries where we know most of the contaminated wells were placed. But in addition, we're only looking for people that had a residential well between 2006 and 2018. So it means some people that during that time were on municipal supply or city water, and those are unfortunately not eligible in this case. A good rule of thumb is if you've had mailings from us, or if you've participated in other PFAS studies run by MDHHS, you will be eligible. And if there's any questions, you can always call us and we can figure it out. One other thing to note is we had to exclude some people based on their occupation. So for MSS specifically, we have to exclude people that were occupationally exposed to PFAS. So firefighters that used PFAS containing firefighting foam in their past, or those that work specifically in industries, cannot participate in the study because we're truly focused only on the drinking water component. There are other studies run by MDHHS and others that are focusing on these different types of exposure, and we can't combine the 2 together to come to the right research conclusions. Like I said, most people that have participated in MIPES specifically, or some other PFAS studies, if you get our mailings, you will likely be eligible also for MSS, and we really encourage you to join both of these studies. I think there's value in both of them, not just for us, but also for you that wants to participate. And very importantly, and the difference is that we take people, children for ages 4 and up, and including the blood testing component for this. So yeah, that's me.
So I would like to share some of the personal benefits of joining the multi-site study. As we already mentioned, the multi-site study is the first nationwide PFAS exposure and health study in the US, and we expect that results from this large-scale study will help decision-making on how to address PFAS at the national level. Also, all participants that provide blood for PFAS testing will receive their personal blood PFAS concentrations, and that's free of charge, just as part of participation. That is in addition to the Visa gift cards that are offered to thank participants for their time in this study. And participants will also contribute to the scientific knowledge about PFAS, including how exposures can affect health. I would like to also point out that all of the states involved in the multi-site study are attempting to look back in time and reconstruct past groundwater and drinking water conditions in our study areas. To do this, we will use information about the source of PFAS and groundwater conditions to try and model or predict what PFAS might have been like in the water during the years before it was discovered. So if successful, this modeling will give an approximate idea of PFAS contamination across large sections of our study areas. It will not be specific to any one participant or any particular home address. One extension of that work could be that we are able to similarly estimate what past blood concentrations might have been like for the population consuming those past levels of PFAS in drinking water. But again, it won't be possible to make those predictions at the individual level. Next slide, please, Ellery. So two other unique elements of participation in the multi-site study include contributing to a new nationwide data set that includes many health outcomes, including specifically measurements of children's behavioral and cognitive development. So we have trained professionals that use standardized games and puzzles and questions to measure aspects of neurodevelopment. These data should be an important piece of the understanding of PFAS, and it is an area that is currently understudied. And finally, eligible multi-site study participants will be invited to join a Michigan-specific expansion to the multi-site study. That's called the Birth Outcomes Supplemental Study. This was a special supplemental award that Michigan got to expand our study to include an extra research topic that we thought was important. Each state got the chance to propose their own expansion, and this is what we proposed. So as you can see here, the goal of BOSS, or the Birth Outcome Supplemental Study, will seek to better understand how PFAS exposure might affect a mother and baby's health during pregnancy and birth. We have not begun enrolling participants in this expansion yet, but we will start soon.
All right, so as you all know, we are still in the COVID-19 pandemic, and we are taking measures to make sure that participation is safe for both our participants and our study office staff. You can see some of the measures that we are taking up here on the slide, but just to sum it up, before entering the study office, we're requesting that participants do their survey over the phone. And also answer some screening questions over the phone before entering the office. Once people enter the office, we are checking temperatures and asking folks to wear a mask or face covering over their nose and mouth. And of course, all study office staff are screened for COVID-19 before every work shift. They also are wearing face coverings and gloves and are doing extensive cleaning and sanitizing in between appointments. Next slide. All right, so here we have an overview of the entire timeline for PFAS health studies. So as my colleagues alluded to earlier, we just completed the first phase of the Michigan PFAS Exposure and Health Study, or MIPES as we like to call it. And so you can see the little car on this slide has moved forward to MSS, or the multi-site study. So we actually just completed data collection for MIPES, and we got 1,305 participants, which is awesome. For MSS, we are only doing 6 months of data collection here, and we're only accepting the first 1,000 adults and 300 children to join the multi-site study. So we do have a ways to go after that. We have 2 more data collection time points or phases for MIPES, as you can see here on this timeline, and we're aiming for 2026 to wrap up all of the health studies. So if you want to join this nationwide health study, MSS, now's the time to do it.
I really want to encourage anyone that's in the City of Parchment, Cooper Township, or the Belmont Rockford area right now, or who knows anyone who lives there, to call 877-256-8073 to enroll in the study. You will find out if you're eligible over the phone. I will encourage you to call anytime from 8 a.m. to 8 p.m. That is when the phone lines close. We also have web pages at michigan.gov/DEHbio. If you follow the multi-site health study logo that you can see in the corner of the screen, that will take you to the multi-site health study pages where we do have a contact us box that you should be able to enter your information, and we can find out if you're eligible that way and contact you about the study. There's also the phone number listed there, as well as a lot of other information. So please, we encourage you to check it out. Now I want to turn it over to you, the community, and find out if anyone has any questions for our research team today. I can allow people to unmute themselves. And so if you have a question, please feel free to unmute and ask. Or as I said, you can type it into the chat and we can read it out that way. I do not currently see any questions in the chat. But I will type in our website URL. And so that is there. I see that Sandy, you've raised your hand. Do you have a question for us?
Yeah, mostly because I hate it when people don't ask questions. So the only thing I had was I had 2 neighbors call me that have been calling the number and have been left on hold or not getting an answer. So that's going to limit participation if they can't get through. So is there another way that they should do it? Was that just a slow startup problem, or what would you like me to tell them?
We'll definitely follow up on that. Thank you so much, Sandy. I think tell them to call the number again. Check and make sure they're calling during the number switch is open. Which does anyone know that off the top?
That was 8 a.m. to 8 p.m.
Thank you. But we'll follow up on that.
Okay, thanks.
Yep, thank you, Sandy. We appreciate that, and we apologize for any wait times. That's never fun to be left on the phone and hold. So,
Sandy, we're also trying to look for in-person recruiting opportunities. So we have one coming up in the City of Parchment Library next Saturday, but we're looking for opportunities in the Belmont Rockford area too. So if they're having problems, they can either call us and we can help enroll them, or they can maybe join us in one of our in-person. They can talk to us, we can answer their questions and like enroll them on the spot. So hoping that opportunity comes really soon as well.
That's great. You know, I'm from Parchment, so if you need any help recruiting at Kindleberger Park, it's my old stomping grounds.
We've tried that one, right, Ellery?
yep, we did go to the Kindleberger Summer Festival this past summer. It was a really nice event. That's a really nice park. Does anyone else have any questions for our research team? I do want to know that this presentation is being recorded, and we do plan to share the recording and the presentation slides on our website. And so if you have friends or neighbors who might have missed the presentation tonight, hopefully they will be able to listen to it soon. We're also available at any time if anyone has questions. They can definitely call the phone number that's up on the screen to enroll. And then we also have our research hotline number that I can post in the chat. And if no one else has any questions, I think we can probably wrap up a little early once I find that phone number.
Yeah, I have it handy. I can throw it in the chat, Valerie, the research hotline phone number. So this is the phone number that you would call if you want to talk to any of us or any of the research staff. And that phone number, in case anyone is joining from their phone and can't see the chat, that phone number for our research team is 1-844-464-7327.
Perfect. Thanks, Taylor. So as Taylor said, that phone number is if anyone has any other questions for our research team, you can call that number and they will give the questions directly to us. The phone number to call and enroll in the study, again, is 877-256-8073. We really encourage anyone listening to enroll, and please tell your neighbors, friends, or anyone local that you know in the area to find out more information about this study, because it is very important that we get as many people as possible to join. With that, if no one else has any further questions, I think that we can say goodbye for tonight, and we will be sharing more information soon on our website. We are updating on a regular basis, including with enrollment numbers and information, so you can keep track of how many people are enrolling. The website also, as I mentioned, has a spot where you can enter in your contact information and we can contact you to find out if you're eligible and to enroll in the study. There's also a spot to sign up for our newsletter, which we provide on a regular, semi-regular basis to provide information about not only the multi-site health study, but our other health studies going on. Okay. Thank you everyone for joining us. We really appreciate it. Have a good night.
Thank you, everyone.
Bye.